What do you think is the worst thing you can do for low back pain? Do you think that it's having bad posture, or sitting too much, or lifting incorrectly, lifting with your back? Nope. The worst thing that you can do is actually worrying about any of those things. Fear of pain is actually more disabling than pain itself. The fancy word for excessive fear is catastrophizing. You take a small problem and through catastrophizing, turn it into a life-altering disaster. You're making a mountain out of a molehill. So today I'll talk about why fear and catastrophizing are so bad for low back pain and how you can avoid it. Real quick, I'm Dr. Anthony Davis, and I empower people with chronic low back pain and sciatica to reclaim the active life they love using a holistic approach to rehab. If you want a deep dive on how to conquer chronic low back pain and sciatica, watch the masterclass. The link is in the description. Let's start with the good news. You don't need to worry about most low back pain. The first rule of low back pain and sciatica is don't panic. You're going to be okay. Back pain and sciatica are almost never caused by a dangerous disease, and acute low back pain usually gets better within about 6 weeks. However, it can linger at a low level for up to a year. That is normal. So you don't even need to have fancy and expensive treatment because time is on your side. Feel-good treatments like massage or chiropractic or cupping, these things are optional, but they can help to reduce pain temporarily while your body heals itself. Not necessary, but if it feels good, it's fine. So if most low back pain goes away on its own, then why are so many people struggling with low back pain? Why is low back pain the #1 cause of disability in the world? Well, low back pain is split into two big categories: acute pain and chronic pain. Acute pain is short duration. Chronic pain is any pain lasting more than 3 months. Around 80% of people will experience at least one episode of some kind of back pain at some point in their life. For most people, this is just a temporary setback. It's hard to bend over for a week or two, things are really sore, but then the pain goes away. But some people develop chronic, long-lasting low back pain. As I mentioned, chronic low back pain is the #1 cause of disability in the entire world. So obviously, you don't want an acute flare-up of low back pain to transform into chronic pain. And this is where fear and catastrophizing rears its ugly head. Catastrophizing drastically increases the likelihood of acute pain turning into chronic pain. Let's talk about how this happens. Catastrophizing consists of 3 main parts: magnification, rumination, and helplessness. Magnification occurs when people believe that their low back pain is caused by a serious problem. You go ask Dr. Google and the internet tells you that you're dying every time. This severe overestimation of your condition causes unnecessary fear. Fear leads to stress, which actually increases physical pain. Don't believe me? This study shows that people with high stress are almost 3 times more likely to have chronic low back pain. Still don't believe me? Let's look at this study. Step 1, the participant squeezes their own left hand with their right hand. Step 2, a stranger squeezes the participant's left hand. The stranger's squeeze caused even more pain, even when the pressure was exactly the same. It's like being pinched by a stranger. It's a lot scarier than pinching yourself or being tickled by a stranger. You can't tickle yourself. So the fear of the unknown is what makes it hurt more. The same concept applies to low back pain. If it causes fear, you will experience more pain. Not to mention that fear leads to high stress, which raises your blood pressure, tightens up your muscles, leading to deoxygenation, poor nutrient delivery, muscle fatigue, atrophy, and ultimately more pain. So remember, the first rule of low back pain and sciatica is don't panic. Now, let's look at the second part of catastrophizing, which is called rumination. Rumination is the inability to stop thinking negative thought. It's like being caught in this spinning whirlpool of negativity, and you just can't escape it. You can't stop stressing out about your low back pain. Pain leads to fear, which leads to stress, which leads to more pain, which leads to being more afraid, and then more stress, and over and over and over again. You have to break the cycle. You need to calm yourself. Take a breath. Remind yourself that most likely there's no serious damage, and that most people just like you will be okay eventually as long as you do the right things now. Yes, even if you have a disc herniation, most of them heal, and even if they don't, most people are walking around with a disc herniation and they don't even know it. Oh, and as always, when I use this model, this is not how disc herniations work. Your discs are actually much, much tougher, and this leads to an inaccurate portrayal of the disc, leading you to think that it's fragile, like this is just popping out. That is not how discs work. I have tons of videos explaining this, but don't be afraid because your discs are like tough rubber. So when my patients have a flare-up, what I tell them to do immediately is let's start with some gentle breathing for just a few minutes. Then I teach them how to explore gentle movements so that they can get out of that sudden severe pain by gently loosening things up. Because the worst thing you can do is seize up and refuse to move your body out of fear. Instead, gently test the waters. Ease back into some form of gentle movement, even if it is a little bit painful. Now, there's a lot more to this, and it is something that I teach my clients in the Beyond Back Pain program. The final piece of catastrophizing is called helplessness. Helplessness is just the belief that there's nothing that you can do to alleviate your low back pain. You feel like there's no hope and that the pain is going to last forever. But remember from earlier, most episodes of pain will resolve in about 6 weeks and usually do not have a serious cause. And even when pain is chronic, it doesn't mean you're broken. It just means that you haven't really had a truly holistic, comprehensive rehab program that looks at your whole life and holds you accountable to implementing a real solution. As always, watch the masterclass if you want a real solution. Of course, the link is in the description. The 3 components of catastrophizing lead to avoidance behavior. This should be pretty intuitive. If you spend the entire day thinking about a scary and unfixable problem, then you're probably going to do everything in your power to avoid potentially painful activities because you're afraid of making it worse. Most people start avoiding lifting heavy things or working a physical job or doing yard walk or even going for walk. And definitely people avoid bending, lifting, or twisting. Essentially, people tend to avoid any physical activity. Now, taking it easy for a short time is fine, but long-term avoidance behavior leads to disuse and disability. Disuse happens when people avoid any movement that stresses out the low back. They do this thinking they're protecting their low back, but actually the body needs stress. It needs movement because stress followed by rest and recovery leads to stronger muscles, harder bones, and more mobile joints. So depriving the back of stress and movement doesn't keep you safe. It actually makes you more weak, stiff, and fragile. And with enough time, disuse leads to disability. People with low back pain go from avoiding an activity because it hurts to simply being unable to even do the activity because they're deconditioned. This is a classic use it or lose it scenario. Like you avoid squatting because it hurts, and pretty soon you become too weak to do a squat. This might not seem like a big deal, but squatting is essential for daily life. Picking up a kid or getting up off of the toilet, standing up off of the ground, these are all going to involve squatting. If disability becomes bad enough, then it becomes impossible to do meaningful activity. And this drastically increases the chance of developing mental health issues like depression. Disuse, disability, and depression trap people into chronic pain because it makes it very difficult to treat low back pain. We know that if you have chronic pain, you should exercise, eat healthy, sleep, have a positive attitude, and generally live a healthy lifestyle. But these are all very difficult to do if you're feeling depressed, deconditioned, and disabled. So if you have low back pain, whether it's acute pain or chronic pain, you need to do everything in your power to avoid catastrophizing. But how do you avoid it? First, remember that the vast majority of low back pain is not serious. You don't need to worry about some scary underlying disease unless you have major red flags, which your doctor would have told you about. Some of the more concerning red flags for low back pain would include a traumatic accident, loss of bowel or bladder function, rapid loss of strength, muscle atrophy, fevers, sweats, chills, rapid and unexplained weight loss, things like that. If you have some of these symptoms, obviously see your doctor, but if you don't, then you really don't need to be worrying about the cause of your low back pain. The diagnosis actually isn't that important. Second, we can combat deconditioning and disability with exercise. Start with a gentle movement test. Find a movement that's right on the edge of what you're comfortable doing. So if walking 1 mile hurts, then try walking half a mile. If doing a full squat hurts, just try doing half a squat. Third, analyze the results of your movement test. So this is where it can get tough. Was the activity too easy? Should you be doing something harder? Is it okay for there to be some pain, or should all movement be pain-free? Obviously, these answers depend on your unique situation. One of the most important things that I do in the Beyond Back Pain program to help people is to understand their pain so they can answer these questions. Is this too much? Is this too little? Is this type of pain safe? Is this type of pain unsafe? Should I back off, or should I move into harder exercises? The goal is to take many little steps forward and avoid big setbacks that are going to come from progressing too quickly and skipping steps. So let's recap what we learned today. We learned that fear or catastrophizing is the worst thing that you can do for low back pain. Catastrophizing is made up of magnification, rumination, and helplessness. These three mental states trap people in chronic low back pain by causing deconditioning, disability, and depression. So the best thing that you can do for your back pain is to avoid catastrophizing by learning the facts and, of course, exercise. If you're already struggling with chronic low back pain, or you think you're on the slippery slope of catastrophizing and giving into the fear, you need the fact. If you have a disc herniation, you probably think that bending your spine is dangerous. I made a video telling you the 4 things that you need to avoid in order to heal your disc herniation. As you might expect, this is a research-based video showing that movement is medicine and helping dispel the fearful myths about low back pain so that you can ease back into regular activity and reclaim the active life you love. So watch this video next and learn the 4 things that you actually need to avoid in order to heal your disc herniation, and I'll see you there.